Today, we talk about your blood pressure medication, specifically if you are over the age of 60. Your blood pressure might look absolutely perfect on paper right now. You might go into the clinic, the nurse wraps the cuff around your arm, and the monitor reads 120/80. Your doctor smiles, gives you a thumbs up, and sends you on your way. But I am here to tell you that a perfect number on a piece of paper does not always mean your treatment is safe. And it certainly does not mean it is the right treatment for your body at this stage of your life. As the body changes after 60, certain medications that once worked beautifully can begin to create serious problems quietly, without obvious warning signs, until something catastrophic happens like a fall or a fainting spell. Today, we talk about your blood pressure medication, specifically if you are over the age of 60. Your blood pressure might look absolutely perfect on paper right now. You might go into the clinic, the nurse wraps the cuff around your arm, and the monitor reads 120/80. Your doctor smiles, gives you a thumbs up, and sends you on your way. But I am here to tell you that a perfect number on a piece of paper does not always mean your treatment is safe, and it certainly does not mean it is the right treatment for your body at this stage of your life. As the body changes after 60, certain medications that once worked beautifully can begin to create serious problems quietly, without obvious warning signs, until something catastrophic happens like a fall or a fainting spell. You are going to start to see how stability matters just as much as control. We have become so obsessed with controlling the number that we forget about the stability of the patient. Understand that symptoms like mild dizziness or afternoon fatigue are not just normal signs of aging that you should ignore. If you take blood pressure medication, today's discussion can change how you view your treatment and the questions you ask your doctor. Because sometimes, the real risk is not the high blood pressure itself, it is how recklessly it is being managed. Before we get into the specific pills to avoid, we need to understand the basic science of how your body changes. I promise to keep this simple, using plain English, but we must look at the facts. When you are young, your blood vessels are like fresh, flexible rubber hoses. When your heart pumps, they expand easily to absorb the pressure. But as we cross 60, and certainly into our 70s and 80s, those rubber hoses start to become more like stiff copper pipes. This process is called vascular stiffness. Because the pipes cannot expand as well, the pressure inside them naturally goes up. At the same time, you have tiny sensors in your neck called baroreceptors. Think of these like the thermostat in your house, but instead of sensing temperature, they sense blood pressure. When you are young, if you stand up quickly from a chair, gravity pulls your blood down to your legs. Your baroreceptors instantly sense the drop in pressure and signal your heart to beat faster and your vessels to tighten, pushing blood back up. You never even notice it. But after 60, these baroreceptors become slower and they do not react as fast. Add a powerful blood pressure pill into that mix, a pill that artificially forces the blood vessels to stay wide open. And when you stand up, the blood drops. The sensors fail to react in time. The pill stops the vessels from tightening, and suddenly your brain is deprived of oxygen. You get dizzy, the room spins, and you might fall. This is called orthostatic hypotension, and it is a leading cause of bone fractures and head injuries in older adults. The American Geriatric Society warns against this in their Beers criteria, a list of medications potentially inappropriate for older adults. Furthermore, your kidneys and liver, responsible for filtering these medications, naturally slow down. A dose that cleared in 12 hours when you were 50 might take 24 hours to clear now. If you keep taking the pill every day, the drug starts to build up in your system, leading to accidental overdoses and toxic side effects even if you are taking the exact prescribed amount. This is the physiological reality of aging, and it is exactly why the first blood pressure pill I strongly caution against after 60 is a class of drugs known as central alpha agonists, with the most common one being Clonidine. Clonidine is an older medication, and it works by directly targeting the brain. It tricks your brain into thinking your blood pressure is too high, so the brain sends out emergency signals to your nervous system to stop releasing adrenaline and to relax the blood vessels. While this does lower blood pressure, it does so in a very heavy-handed way. For a younger person in a hypertensive crisis, it might be used, but for someone over 60 managing daily blood pressure, it is incredibly risky. The primary issue with clonidine is extreme sedation and slowing down of the central nervous system. Patients often report feeling like they are walking through wet cement, experiencing profound brain fog, dry mouth, and overwhelming fatigue. Because it acts on the brain, it significantly increases the risk of falling, which, as referenced by the Centers for Disease Control and Prevention, is the leading cause of fatal and non-fatal injuries among older adults. But the most dangerous part of clonidine is what happens if you miss a dose. Older adults sometimes forget a pill. It happens to everyone, and it is a common mistake we all understand. With clonidine, missing even 1 or 2 doses can cause a severe, life-threatening phenomenon called rebound hypertension. Because the drug was artificially holding the brain's adrenaline system down, removing the drug suddenly causes the system to snap back like a stretched rubber band. Your blood pressure can shoot up to dangerously high levels, much higher than it was before you ever started the pill, putting you at immediate risk for a stroke or a heart attack. The American Geriatrics Society, Beer's criteria specifically lists clonidine as a medication to avoid in older adults, due to its high risk of adverse central nervous system effects and rebound hypertension. There are much safer, smoother medications today that do not hijack the brain's central command center. The second pill I would generally never reach for first in a patient over 60 is the alpha-1 blocker. You might recognize names like doxazosin, prazosin, or terazosin. These meds block alpha receptors in your muscles, which normally signal your blood vessels to tighten. By blocking the signal, the vessels stay relaxed and wide open, causing blood pressure to drop. On paper, it sounds like a perfectly logical way to treat high blood pressure. However, these drugs are notorious for causing sudden drops in blood pressure when you change positions. Remember those sluggish baroreceptors we talked about earlier? Alpha blockers make that problem 10 times worse, because they forcibly paralyze the blood vessel's ability to constrict. When you stand up from bed in the middle of the night to use the bathroom, your body has absolutely no defense against gravity. The blood pools in your legs, your brain loses flow, and you collapse. In the medical world, we call this the first dose effect, because it is incredibly common when you first start taking the pill. But it can happen at any time, especially if you get a little dehydrated or stand up too quickly. The evidence against using these as frontline treatments is massive. One of the most famous and comprehensive studies in cardiovascular medicine is the ALL-HAT trial, the antihypertensive and lipid-lowering treatment to prevent heart attack trial. This was a massive study designed to see which blood pressure medications were best at preventing heart attacks and saving lives. The researchers actually had to abruptly stop the part of the trial testing the alpha blocker doxazosin. Why was this massive clinical study stopped so suddenly? Because patients on doxazosin had a 25% higher rate of cardiovascular events and double the risk of heart failure compared to a simple water pill. The science is incredibly clear here. Alpha blockers lower the number but don't protect the heart and increase fall risks. They are sometimes used for an enlarged prostate as they relax bladder muscles, but for blood pressure alone, risks far outweigh benefits for most aging adults. Ask your doctor if your dizziness is a side effect of an alpha blocker. The third category, older beta blockers like Atenolol, is popular but often misused. Beta blockers end in -olol, like metoprolol, bisoprolol, and Atenolol. Let me be very clear. If you have had a heart attack, if you have heart failure, or if you have a specific heart rhythm problem like atrial fibrillation, beta blockers are life-saving drugs. You absolutely need them, and you should never stop taking them without consulting your cardiologist. However, if you are over 60 and have a healthy heart, using an older beta blocker like Atenolol for high blood pressure is outdated. Beta blockers work by blocking the effects of the hormone epinephrine, also known as adrenaline. This causes your heart to beat more slowly and with less force, which naturally lowers blood pressure. But think about what it means to artificially slow down the heart in an older adult. Your heart is the engine that pumps oxygen to your muscles and your brain. When you put a governor on that engine, you feel it. Patients on Atenolol frequently complain of feeling constantly exhausted, having cold hands and feet, and losing their exercise tolerance. They try to walk up a flight of stairs, but because the drug prevents their heart rate from increasing to meet the physical demand, they feel completely winded and weak. But the real problem with older beta blockers for high blood pressure is that they simply do not work well enough to prevent the worst outcomes. High blood pressure is dangerous primarily because it causes strokes. The Cochrane database of systematic reviews, which is considered the gold standard for evaluating medical research, conducted a massive review. They found that beta blockers were significantly less effective at preventing strokes than calcium channel blockers or modern ACE inhibitors. In fact, patients on older beta blockers had a 16% higher risk of stroke compared to those on other modern medications. Furthermore, for older adults who might be managing type 2 diabetes or prediabetes, beta blockers can mask the warning signs of low blood sugar. When your blood sugar drops, your body's natural alarm system is a rush of adrenaline, which causes a rapid heartbeat, sweating, and shaking, telling you that you need to eat something immediately. Because beta blockers block adrenaline, they silence that alarm bell. An older adult could experience a dangerous drop in blood sugar and never feel the rapid heartbeat warning them, leading to a diabetic coma or severe confusion. So, we have a drug like Atenolol that makes you tired, slows you down, masks diabetic emergencies, and does an inferior job at preventing strokes compared to alternatives. If you take a beta blocker purely for high blood pressure, this is a prime example of a medication you need to respectfully question with your physician. Medicine has evolved, and better, safer options exist that do not drag down your entire physical energy system just to make a monitor read 120/80. We have covered the critical physiological changes of aging, the dangers of central agonists, alpha blockers, and the risks of older beta blockers like Atenolol. This brings us to the end of the first part of this crucial discussion. The fourth category of blood pressure pills I would heavily scrutinize after 60 includes direct vasodilators, specifically medications like hydralazine and minoxidil. These drugs are considered older brute force medications. They work by directly forcing the smooth muscle inside your artery walls to relax and widen. On the surface, this drops your blood pressure rapidly, but it triggers a catastrophic chain reaction in an older body. When you artificially force the blood vessels open with hydralazine, your body panics. Your brain interprets this sudden, massive widening of the arteries as a sign that you are bleeding or going into shock. Immediately, your sympathetic nervous system kicks into overdrive. It signals your heart to beat much faster and much harder to compensate for the sudden drop in pressure. This is a condition called reflex tachycardia. Imagine driving a car, taking your foot off the gas, but your car's computer suddenly decides to floor the accelerator to compensate. It is incredibly stressful on an aging heart and can easily trigger angina, chest pain, or even a heart attack in vulnerable individuals. But the body's panic does not stop there. Because the blood pressure dropped so artificially and abruptly, your kidneys also sound the alarm. The kidneys assume you must be severely dehydrated, so they activate a complex hormonal system called the renin-angiotensin-aldosterone system. This system forces your body to aggressively hold on to salt and water. Within days, your legs and even your lungs can fill with excess fluid, leading to massive swelling known as severe edema. This leads us to one of the most dangerous situations in geriatric medicine, the prescribing cascade. Because hydralazine caused your heart to race, your doctor might prescribe a beta blocker to slow it down. Because it caused leg swelling, you're given a water pill to force your kidneys to flush the fluid out. Suddenly, you are taking 3 heavy-duty medications just to manage the complications created by the first pill. This polypharmacy leads to profound fatigue, frequent bathroom trips, and an incredibly high risk of falling. The American Geriatric Society advises avoiding direct vasodilators as the cascading side effects are too damaging after 60. The fifth and final medication type I want to warn you about involves short-acting calcium channel blockers, specifically immediate-release Nifedipine. I need to be precise. Long-acting calcium channel blockers, like amlodipine, are generally very safe and highly effective in older adults. The danger lies specifically in the short-acting, immediate-release versions. In the 80s and 90s, it was common to give short-acting nifedipine to rapidly drop pressure, even under the tongue. We now know from JAMA data that this practice is incredibly dangerous, especially for older adults. Short-acting nifedipine causes a sheer, cliff-like drop in blood pressure. The pressure plummets so fast that the body has absolutely no time to adapt. For an older adult with stiffened arteries, a certain amount of driving pressure is required to force blood through narrowed vessels into the brain and the heart muscle. When that pressure suddenly vanishes, those vital organs are instantly starved of oxygen. This rapid starvation, known as ischemia, is a well-documented trigger for sudden strokes and severe heart attacks. The sudden drop also causes intense flushing of the face, throbbing headaches, and severe dizziness. The medical consensus is now crystal clear that immediate release, short-acting calcium channel blockers should almost never be used to manage routine high blood pressure, especially in older adults, due to the unacceptable risk of causing the exact cardiovascular events we are trying to prevent. Now that we have covered the pills to avoid, we must discuss a fundamental shift in how we view blood pressure targets as you age. The medical community used to believe that lower was always better, regardless of age. But massive clinical studies have revealed a concept known in geriatric cardiology as the J-curve phenomenon. Imagine a graph shaped like the letter J. The bottom curve of the J represents your risk of dying or having a major health event. If your blood pressure is too high, you are on the upper right side of the J, and your risk of stroke goes up. However, if your doctor aggressively pushes your blood pressure too low, you slide up the left side of the J. Your risk of heart attacks, kidney failure, and fatal falls skyrockets. But why does this happen in older adults? Because an older cardiovascular system requires slightly higher baseline pressure just to keep blood flowing through rigid pipes. Major organizations recognize that pushing a senior's blood pressure to 120/80 might look beautiful on a chart, but it can actively harm the patient. For many older adults, especially those who are frail or have a history of falls, a perfectly acceptable and much safer target might be 130/80, or even 140/90. Stability and safety must take priority over a mathematically perfect number. It is far better to have a blood pressure of 135/85 and be completely active, energetic, and steady on your feet, than to have a blood pressure of 115/70 while feeling constantly dizzy, exhausted, and terrified of falling every time you stand up. To protect yourself from over-medication, you cannot rely solely on the readings taken at your doctor's office. The anxiety of being in a clinical setting often causes white coat hypertension, where your pressure temporarily spikes just because you are nervous. If your doctor prescribes medication based purely on that artificial spike, you will be heavily over-medicated when you are relaxing at home. You must measure your blood pressure at home, but you must do it correctly, or the data is useless. First, do not check your pressure right after walking up the stairs or drinking a cup of coffee. You must sit quietly in a chair with your back supported for at least 5 full minutes before pushing the button. Second, keep both feet flat on the floor, never cross your legs, as this artificially raises the pressure. Your arm must be supported on a table so that the blood pressure cuff is exactly level with your heart. Third, ensure you have the right cuff size. If the cuff is too small, it will read falsely high. If it is too loose, it will read falsely low. Ensure the cuff fits securely around your bare upper arm. Finally, and most importantly for older adults, you must check for orthostatic drops. Take your pressure while sitting down. Then, stand up safely, wait exactly 1 minute, and take it again while standing. Wait 2 more minutes and take it a third time. Wait 2 more minutes and take it a third time. If the top number drops by 20 points or the bottom number drops by 10 points after you stand up, you have orthostatic hypotension. You must write these numbers down and show them to your doctor immediately, as this is the primary warning sign that you are over-medicated. If you are experiencing unexplained fatigue, brain fog, cold extremities, or any dizziness when you change positions, you must not accept these as just a normal part of getting older. They are very often the quiet, insidious side effects of the wrong blood pressure medication. At your next appointment, bring your home blood pressure log and all of your pill bottles. You need to have a collaborative, direct conversation about a concept called deprescribing. Deprescribing is the careful, medically supervised process of reducing or stopping medications that are no longer beneficial or are causing more harm than good. You should ask direct questions. Look at your doctor and ask if any of the medications you are taking are on the Beers criteria list for older adults. And please, discuss your symptoms openly with your healthcare provider. Tell them you are experiencing dizziness when you stand up and you are concerned your blood pressure might be dropping too low at home. Ask if you can review your medications to see if one of them is causing this. Don't be afraid to request alternatives if your current medication isn't working for you. If you are on an older beta blocker like Atenolol or a central agonist like Clonidine, ask if there is a smoother, more modern medication like an ARB or a long-acting calcium channel blocker that might control your pressure without causing this severe fatigue. Remember, your doctor wants you to be healthy, but the current medical system is rushed. You have to be the advocate for your own stability and quality of life. High blood pressure is a serious condition that absolutely requires treatment to prevent strokes and heart disease, but the treatment must evolve as your body evolves. The right medication at age 45 can easily become the wrong medication at age 70. Focus on stability, listen to your body's warning signs, demand smoother treatments, and never settle for a medication that steals your energy and your balance just to satisfy a number on a chart.